So I have two quick cases. I'm sure other people have some, but can you guys hear me and see my screen?
Yep.
Okay. So this is a young woman. You can see as we're going down into her pelvis, she's got this T2 hyperintense mass here that seems fairly affiliated with this neural foramen. It's kind of going in an elongated fashion over there. And then as we go down a little bit further, she's got another one. So any thoughts about what those could be? They're pretty bright. They're like kind of going along the nerve roots. So Steve, we can't hear you. Can you unmute yourself?
Am I unmuted now?
Huh?
Am I unmuted now?
Yes.
How about neurofibromas?
Yes, exactly. So this young woman has neurofibromatosis type 1. And in fact, actually, she's already lost her leg because she had a huge malignant peripheral nerve sheath tumor in her leg, and they actually even had to resect some of her pelvis. So she already lost that, but she has these other neurofibromas. And then we had this lesion over here that looked different than the two neurofibromas that I showed you. And so we kind of were thinking this has more of like the evil gray of tumor. So we were more concerned about this lesion. And if we go to the post-contrast, you can see those neurofibromas. And one thing I wanted to point out is, even though the neurofibroma was T2 hyperintense peripherally, generally neurofibromas have more central enhancement like this. Whereas this other lesion that was more T2 gray has more peripheral enhancement. And this is a feature that's seen more commonly with malignant peripheral nerve sheath tumors. So we were concerned that even though these two might just be run-of-the-mill neurofibromas, that this would be an MPNST, or malignant peripheral nerve sheath tumor. And we biopsied this lesion, and that's what it came back as. So it came back as MPNST/sarcoma. So anyway, I just wanted to point out the different features of like just a kind of plain neurofibroma versus one that has more concerning features. And also another concerning feature would be if like the borders were more irregular. This case, the borders weren't that irregular, but that's another feature if it has more infiltrative borders. The other possibility we brought up was a GIST tumor. The reason we brought that up is that neurofibromatosis patients also have an increased incidence of GIST, although they tend to have them more in their duodenum. But we did bring that up, and we were hoping that maybe this would be a GIST tumor, but unfortunately it's a MPNST. So any comments or questions? I have one more case.